All right, future doctors, today we're mastering Nephrotic Syndrome for USMLE Step 1. This is one of those topics where if you understand the mechanism, you can answer almost every board question. Let's build this from zero to exam-level thinking. Step 1. Definition. Lock this. In nephrotic syndrome is defined by 5 things. Proteinuria greater than 3.5 grams per day, hypoalbuminemia, edema, hyperlipidemia, lipiduria. If you see massive protein loss without major hematuria, think nephrotic. Boards love giving you edema plus 3+ protein on urinalysis. That's your trigger. Step 2. Core mechanism. What's actually broken? Nephrotic syndrome is fundamentally a podocyte problem. Remember the glomerular filtration barrier 1, endothelium 2, glomerular basement membrane 3, podocytes. Podocytes have slit diaphragms. When they get injured, then the slit diaphragm fails, then albumin spills into urine. That's the root of everything. If nephritic is inflammation, nephrotic is structural barrier failure. Step 3. Why does edema happen? Let's think like the exam. Step 1. Albumin is lost in urine. Step 2. Plasma oncotic pressure drops. Step 3. Fluid leaves blood vessels and enters tissues. Step 4. Body senses low circulating volume. Step 5. RAAS activates to sodium and water retention. Step 6. Even more edema. This is why kids show up with periorbital puffiness. Step 4. Why hyperlipidemia? The liver sees low albumin and says, let's make more protein. But it doesn't just make albumin. It increases LDL, VLDL, total cholesterol. And now you get fatty casts, oval fat bodies. Maltese cross appearance under polarized light. If they mention Maltese cross, you're done. Nephrotic. Step 5. Major complications. Boards love these. 1. Hypercoagulability. You lose anticoagulant proteins in urine. Antithrombin 3. Protein C protein S, so patients clot. Classic board association, renal vein thrombosis, especially in membranous nephropathy. If they say flank pain plus nephrotic plus clot implies think membranous. 2. Infection risk. You also lose immunoglobulins. That means increased susceptibility to infections. Nephrotic patients are immunocompromised. Step 6. Major causes. High-yield patterns. This is where USMLE becomes pattern recognition. Child with edema after URI, most common in children. Minimal change disease. Buzzwords, post-viral normal light microscopy. Negative immunofluorescence. Foot process effacement on EM steroid responsive mechanism. T-cell mediated podocyte injury. If it's a kid, pick minimal change unless proven otherwise. Adult white patient. Most common in white adults. Membranous nephropathy. Key clues. Anti-PLA2R antibodies. Subepithelial immune deposits. Spike and dome appearance. Associated with hepatitis B, solid tumors, SLE, and again, renal vein thrombosis. HIV or African American patient. Think focal segmental glomerulosclerosis. Buzzwords. Segmental sclerosis, poor steroid response, collapsing variant in HIV, high-yield association HIV, most common overall cause of nephrotic syndrome, it's diabetic nephropathy. Key features: Kimmelstiel-Wilson nodules, mesangial expansion, GBM thickening, ACE inhibitors slow progression. If the vignette says long-standing diabetes plus proteinuria, implies that's your answer. Congo red positive, think amyloidosis, apple green birefringence under polarized light, systemic disease, multi-organ involvement, nephrotic versus nephritic, rapid board contrast, nephrotic, heavy proteinuria, edema, minimal hematuria, nephritic, hematuria, RB, C casts, hypertension, mild proteinuria. If they mention RBC casts, It's nephritic. Rapid recall lightning round children to minimal change. White adult to membranous HIV to FSGS, most common overall to diabetes. Renal vein thrombosis to membranous Congo. Red to amyloidosis at final board strategy. When reading a vignette, always ask, what is the age? Any HIV? Any diabetes? Any cancer? What does EM show? Where are immune deposits located? Once you answer those, the diagnosis becomes obvious. Closing line. Nephrotic syndrome isn't random. It's a podocyte problem with predictable patterns. Master the patterns, and you master the boards.